So our next speaker is our past president. And Eric's going to talk to us today, really changing the spotlight onto ourselves and looking at compassion fatigue and burnout. We're just waiting for him to get dressed.
Yeah.
It's a common problem.
Everything is gone now. Yeah, it's okay.
Okay.
Okay. Thank you very much, Teresa. Yeah, I think looking to this subject, a lot of you will think, okay, compassion fatigue. Never heard of it. So in the end, I think you will all understand where I'm going to talk about. And I think Danny has already said something about this, and also Andreas in his talk. Something about compassion. I heard something about burnout. And this is these are two items I'm going to talk about, and at the same time, this is something else. I'm Erik van Marlekom, working as a clinical nurse specialist in Amsterdam. If you look into the, what did you do with this, Andreas? Yeah.
You broke it.
I broke it.
Yeah.
Yeah, there it is. Okay. If you're going into the literature, I must say before I was interested in this topic, I had never heard so much about it. And then you go into the literature and you find all kinds of publications about compassion fatigue. This is from 2016, where it's stated compassion fatigue, the cost of caring. So looking into compassion, because before you can become fatigued, you have to have compassion. And I think compassion is one of our main important items, topics, motivations in our work, because we have compassion with our patients. That's the reason you are here, I think, and that's the reason we are working in oncology. So that's not really a strange thing, of course, to have compassion with patients, because that's what compassion is the feeling that arises in witnessing others' suffering, and that motivates us to subsequent desire to help. And that's what we do, I think. We're all working in oncology, we're all working with patients with a terrible disease, so that motivates us to work in this area. On the other hand, there is compassion fatigue, and what that is, and this is coming from the literature, of course. Compassion fatigue, that has been defined as a combination of physical, emotional, and spiritual depletion associated with caring for patients. Patients in pain and in distress and in disease, so in cancer. I had a very nice video. I won't go and show because otherwise the whole thing will blow up. So I will leave it in so you can have the look on. You can have a look at that later on. But what's happening is if you look to CF, that's compassion fatigue versus burnout, and there is a difference in those two things. If you look to burnout, and I think Danny has expressed that very well, burnout has to do with your conditions, the way you work, maybe the hours you work, the facilities you have, and that can cause a lot of stress. Compassion fatigue is all about patience, what you're facing in the interaction between what you do and what kind of patients you're working with. So it's something else. Sometimes the results are the same, and maybe you can treat it in the same way for yourself, because I will give some solutions in the end, so everybody will be happy in the end, I hope. But it can have the same effect. There is also a relationship in the literature between burnout and secondary traumatic stress that has to do with extreme traumatic situations we're in, and sometimes maybe we also facing traumatic situations. We heard about extravasation, doing things wrong on your work, that can be very traumatic. We all know that maybe. So there is a relationship between those topics, but it is something else. And it's quite old. It's quite old. This is from the 90s somewhere, 1995 already published, and done again in 2001. This is how it works, but in the literature they're always fond of making this kind of ways of explaining what it is. But there is the exposure of suffering, for example. Detachment, empathic response, residual compassion stress, a sense of satisfaction. It has all influence. empathic ability, and that comes to sometimes to compassion fatigue. So it's a way of looking to the topic of compassion fatigue. In the end, it's only a way of looking at it. The most important thing is of how we're going to deal with it. Who are at risk? Now, there we are. Who are the first ones at risk? So, are we happy about that? No, I don't think so, but that's what it is. So, make sure that you stay out of that, or make sure that you stay healthy. But we are at risk in the same with other people working in this environment. Also, doctors are at risk. There's now, recently, the European Society of Surgical Oncology published something on the Twitter that also doctors do have this kind of stress. They don't want to acknowledge that, of course, because it's very hard. We always think that doctors can do everything, but it's not true. Also, they are facing the same things we are facing with the patients. So, now, what do all those people have in common? We're all helping other ones. We're all working in oncology. We're all working with patients with a terrible disease who are treated. Maybe they can be cured. Maybe not. Maybe they will die, or they will have a very long period of being sick, having problems, symptoms of their disease, symptoms of their treatment. So we're all more or less working in the same way, working with young children, or people working with people who are abused, for example. They're all at risk. So the more you are exposed to these kind of items, these kind of patients, the more at risk you are. That sounds sensible, I think. That's not a strange thing. If you only see one cancer patient a year, you can be very compassionate about that patient. You won't get compassion fatigue, I think. But we're all working in a clinical setting, or maybe as managers facing these kinds of traumas and suffering with patients. So to be over-empathic means that the fuel goes empty. This is a very funny thing, I think. This is from a car. You all recognize that. When it's full, it's full. And when it's empty, you can drive, and then there is a certain point, your car will stop. I sometimes try to go as far as I can. I think, no, that's still 10 kilometers to go to get some petrol, but finally it will stop. So that will happen with you also if you don't be aware of that. So what are some symptoms? And I think these are not strange things you see here. What are symptoms? If you look to the more work-related symptoms, and I think Danny said something about that also, we're talking about burnout, avoidance, reduced ability to feel empathy toward patients. So having not a close relationship to patients, but go in distance, not having emotional lack of joyfulness in your work, frequent use of sick leave to say that you're sick. Not because you may be sick, but it's too much to work. Physically, what can you feel? Headaches, problems with your stomach, feeling sleep disturbances, fatigue yourself, getting tired, cardiac problems, chest pain, high blood pressure, that kind of things. And emotional, mood swings. That's normal for women every month, I think. For some women. But if you have that constantly, that's not a normal thing. I can say that. I'm working in a female environment. I know how it works, and that's no problem. But constantly, that's not a good thing, of course. So mood swings, oversensitivity, anxiety, excessive use of alcohol or smoking, for example. So memory issues, loss of objectivity, poor concentration. So all that kind of signs can be symptoms of compassion fatigue. On a more organizational level, and here for the managers in the room here, that's important to see. If you see these kind of complaints, a lot of complaints from your workers, people taking sick leave, call you, I can't work, I'm sick. Bad relationships between workers, that's not a good sign. That's totally not a good sign. Inability to work together, people talking about each other, he's doing this and she's that. That's a very negative atmosphere at work. So that's not a good thing. Aggressive behavior, inability for staff to do the work, for example. are those things. Rumor, gossips, I already said that. So that's a very unhealthy and not very positive way of working together. So, compassion fatigue, burnout, compassion satisfaction among oncology nurses. A lot of research has been done about the relationship between those items. And this is all coming, you can't see that, but it's downstairs. It's all from ONS, of ONG, the Oncology Nursing Forum. So it's America data, but they did a lot of research about this. And what they found is that a healthy and supportive work environment is very crucial to get not burnout, but also the compassion fatigue is also related to that. So it helps prevent improvements in the workplace, helps prevention to get people into compassion fatigue and nurse turnover. This is another study, professionalism. So the more nurses have the ability to professionalize, to become better nurses, better trained, the better, the more effective they are in their work, and less at risk for compassion fatigue, because they're more aware, they're more trained, they know the symptoms, they know how to react on that. The longer you work, the more risks you have. So that's a thing. And to be honest, I'm working now for 30 years, for 30 years now in healthcare, in oncology. And to be honest, I have had those symptoms myself last year, when there was too much pressure on all kind of items. So it has to do with something, you build it up, I don't know. I have never been very emotional about patients' journeys, whatever. I thought, yeah, that's the patient journey and I'm working here. But in the end, it's like you're like a balloon, and then suddenly, or like, how do you say that? Where you're pumping yourself up. It's a balloon when you put in a needle, and then suddenly it explodes more or less. So you have to take care. You have to take care. And a passive coping style, so not being proactive, that doesn't help you. So you have to do something for yourself. Now, he's going to the doctor. Yeah, I'm sorry. Compassion fatigue. So awareness, that's one thing. That's one thing. It's important to recognize these items, to think by yourself, okay, do I maybe have some of those symptoms? And the other thing is, of course, make sure that you make a plan, because that you can do something about it. It's not that we only say, oh, that's what we used to say, oh, nursing, it's so, that sometimes patients said, oh, it's so great what you're doing. And it must be so terrible for you to work in this environment, all those cancer patients and doing that daily. Okay, I say, okay, that's true, but it's also my work. And I like my work. And I think a lot of you do that also. But you have to do something about yourself and have some self-care. I think that's one of the most important things I would like to address in this presentation, because self-care is important. Not always possible. I realize that there are limitations, but I will give you some tips and tricks about things you can do yourself. Be physical. That's one of those things. Not everybody likes this, to be sure. Let's be honest. And we don't have to look like this, everybody, everywhere. Don't worry. But there is something about your physical activity. We promote nowadays patients to be physical active. I'm from the time where we had patients laying 3 weeks in bed after an operation and say, okay, please stay in bed, don't do too much. Nowadays, in 1 week they are out, and the second day we get them out of the bed and do all their things themselves. So that's really a change of thinking. That for ourselves, it's the same. Moving is one of the most important things. We have to keep moving all the time. Eat healthy, exercise, whatever that means. Get a massage. Go to a doctor when you're sick. Nurses are very bad going to doctors themselves. They keep on working. No, I will take some extra pills, or I take some ibuprofen or paracetamol when I don't feel well. But please go to a doctor. Please go to a doctor if you need one. Get enough sleep. I'm terrible about that. Take some days off. If you are able to do something else than only working in healthcare. Be sexual, whatever that means to you, but that can help to get you physically healthy again. Psychological care, that's also important. Look in the mirror. That's difficult. That's sometimes difficult, especially when you're working for a longer period. Is it really what I want? Do I really have to work in the environment I work? Do I like my job? What has to be changed in my job? What can I change that I make sure I like my job even more than I do now? So take in the mirror, look in the mirror and try to do other things. Try new things, for example. Decrease life stress. Maybe get in therapy. I know some of us really are struggling with the stress they're facing. So maybe you need some professional help to make sure you can deal with these kind of items. Spiritual care, that's very individual, but it can help. For some people it means that you are religious. For some people it means that you are meditate or looking for people to connect with you, whatever. But make sure that you open also that area. That's something we maybe are not so aware of that, but it's important to have some spiritual self-care as well. And then at last, relationship care. You know, they are a perfect example, a great example, how that doesn't work. But I think the most important, we're working and we all have to work because we have to live and we need money to live, let's be honest. But it's also important to be with your spouses, with your family, with your friends, with your partner, and invest also in them. Work is important, but private life is also very important. So that's really a thing I would like to address. This is, again, a video. I won't show that now, but go to the link. The funny thing is that this is a doctor who says something about caregivers who have the same thing. If you've got a family member or your partner or your mother or your father who is sick, you're most times very well motivated and compassionate about helping her or him. But in the end, you can also end up with compassion fatigue. That's what she's talking about. So, to conclude, a few things. I've got here that oxygen mask here in the corner. And that's related to the video I wanted to show you. So please go to the video on the link. But this oxygen mask, if you go into in an airplane, and in case of an emergency, they always say, oh no, I don't want to get in that emergency. But in case of an emergency, an oxygen mask will drop, and then you have to first take the oxygen mask yourself, and then help the others. So, and that's the relation with my topic now. If there is something wrong, if you don't feel well, you have to make sure you put on your own oxygen mask first. You can't be a good healthcare provider if you don't put on your oxygen mask first yourself. So we are at risk. We know that. I told you already maybe knew that before, but that's also from the literature. You can have symptoms. That's true. You can do something yourself. I hope I have explained that to you. So self-care is very important. And not only self-care, but also the environment where you work. So I think that's what I wanted to talk about and address in this presentation. Thank you very much.
Thank you very much, Eric. Have we got any questions for Eric? No? Oh, okay, Christina.
You share with us that you have feel compassion fatigue yourself.
Yeah.
What do you have done to ultrapacate everything? And do you search for help? Or do you do something different in your life? That's my question.
Okay, that's very personal, of course, but I will say something about that.
I don't need you to tell me personally, but
I will put it on Twitter, then everybody knows. No.
Maybe you can share with us.
Okay. I think in my daily job, I'm running outpatient clinics, 3-4 a week. So we're seeing a lot of new patients, and all those patients they're having mainly prostate cancer, bladder cancer. So they're all afraid of dying, coming new in the hospital, and we were expanding at times more patients, more and more, a lot of pressure from inside the hospital to make sure that we organize it very well and dealing with all those new patients. And that's where we had a lack of personnel. I had took 2 colleagues fallen out. We needed somebody new. And then I always think, okay, we have to manage this. So let's move on. I'm going to manage all those patients. Don't worry. I did that with my colleague. But in the end, after 3/4 of a year, I thought I was so overwhelmed with not only all those emotions, I think, with those patients, but overwhelmed with the work. So I thought, this is not healthy for myself. So I have to make sure that I reduce the stress. So I made a firm statement. I think we're not going to do this anymore. So I said, we're going to do 2 outpatients clinics a week, and that's it. So that's a pity for all those other patients, because whatever. They go somewhere else, and it was a pity for the hospital. But I think I'm not going to do this, because otherwise I will be at home in the next month. So that's what we did. And I took some holiday. You know how it works with Dutch people. They always work from one holiday to the other ones. But I took some days off, and I really looked in the mirror. Do I want this? Am I going to continue this for the next half year? Because the situation in Malta wouldn't change. So I said, until so far, and now I will stop. And that worked. And then everybody said, oh my God, Erik is saying that he is not going to do it anymore. And that helps. Sometimes it helps to say it. I said, I'm not going to do it anymore. So get somebody else or whatever. I'm not going to do it anymore. So that's what was happened. Yeah. Okay.
Thank you, Erik. That was really poignant. And I'm just thinking that, there must be quite a few of us in this room that have felt that way too. I wonder if we could have a show of hands for those of you that feel able to do so, to say if you've ever felt like that, or elements of that really in the past, I don't know, 5 years. Yeah. So I think it is a common problem, and it's something that we really do need to keep in check and think, how can we move away from this? And as you say, you'd got to a point where you were absolutely exhausted before you checked. Yeah.
I just want to thank you for sharing, Erik, and it's interesting to hear you, because I think that many of us have looked at you as the best one of us to manage this. And also, then even you have this symptom. So I think it can happen to anyone. If it can happen to you, it can happen to everyone. So thank you for sharing.
Thank you.